Hello everyone and welcome to CRAMSURG, Clinical Research Appraisal and Methodology for Surgical Trainees, where we pick a paper fresh from the press on a hot general surgical topic. We review it for you, we present it for you, we critique its methodology for you, and provide top-of-the-field expert opinions and teaching on research appraisal and methodology. My name is Gio Perrin, and together with Professor Saba Balasubramanian, Adam Haig, Ben Wood and Josh Lau, we bring you CRAMSURG from the wonderful region of the Yorkshire and the Humber.
So, we'll talk about hypothesis testing, which is a key aspect of scientific methodology. And we will spend a little bit of time on the principles, and then I have a few sort of scenarios with some questions. So we'll start off with talking about what a hypothesis is. So essentially a hypothesis is simply an idea, a specific idea, or a statement, or a premise that needs to be tested, as opposed to a theory, which is a general statement about a series of phenomena that people generally accept that has been proven previously. Okay, so that's what a hypothesis is. Now you could derive a hypothesis from observations. Now let's just take an example of obesity and infection risk after laparotomy, and that's just an example that I'll use for the purpose of this particular tutorial. So if you as a surgeon have noted that obese patients get a lot of infection based on your experience, or you've done a small study that shows that morbidly obese patients have a much higher infection rate, then from your observations, either formal or from experience, you have developed this hypothesis whereby you say obesity potentially is associated with infection risk. So that is one way of developing a hypothesis. The other way is deriving a hypothesis from one or a set of theories. So you could say that obesity is associated with poor peripheral circulation, and you could say that poor peripheral circulation or reduced vascularity impairs wound healing, and therefore my hypothesis is that obesity increases infection rate. So that's another way of deducing or deriving a hypothesis. That's from theory. Now, that's the example on the side of the screen. So the hypothesis being obesity increases infection rates following laparotomy, and you could have come to this hypothesis based on observations, or you could have deduced this hypothesis from theories. Now, hypothesis, if you have one, is central to your research project or your study. It should be clear, it should be well defined, it should be specific and not general like a theory, and it should be testable. That's kind of logical. So, my question at this stage, and maybe to Josh, is, Josh, does every research project need a hypothesis? That's the question. What do you think?
I think yes. I think it's very easy to mix it up with the objective and aim of a project. Is that right? And
yeah. So the intuitive answer is yes. Logical answer is yes. What do you think, Gio?
Sorry, I had my microphone muted. Yeah, I agree. I think it's yes, although I can read your notes and it says no.
Okay, I'll take the notes away. Yeah. So the intuitive answer is every research needs a hypothesis, but that's not necessarily true, because there are research questions. My next slide will illustrate this in more detail, but there are research questions that do not have a hypothesis. For example, you could have been taking an interest in infection rates following laparotomy, and you could have asked the question, what are the risk factors for infection after laparotomy? So if you ask, what are the risk factors? So you could ask, I want to know more about the pathogenesis of infection following laparotomy. So there's no hypothesis there. That is what we call exploratory research, or research that takes an inductive approach. So the bottom line is, not every research needs a hypothesis. Sometimes you find people standing up at meetings and saying, well, your research doesn't have a hypothesis, so it's not really good research. And that's just not right. Okay, so keep that in mind. So not every research needs a hypothesis. The next slide hopefully will illustrate that better. Okay, so now when we do a hypothesis-based research, the question is, how do we develop the hypothesis? Now, before we even develop the hypothesis, the key is to start off with the research question, or what is the problem that you're trying to address. Okay. Now, once you define a problem, then you look at literature. And can you see my mouse or my arrow?
Yes, we can.
Yeah. Okay. So you search the literature, or you collect your own data to try and see if you can get the background to the problem and if you can get as much information as you can about the problem. With that data, you then generate your hypothesis. Okay, so once you've got your hypothesis, you design a study, collect data, and test the data to see if the data will support the hypothesis or not. If the data does not support the hypothesis, then you go back to literature, you go back again and go through the cycle again and again. And once you've got a few studies that all support the hypothesis, then the hypothesis becomes a commonly accepted truth, if you like. It becomes commonly accepted, almost like a theory, you could say. So, going back to our example, the research question could be, what factors predispose to infection after laparotomy? So that's a very broad question. And that's a question that doesn't lend itself to a testable hypothesis. So once you collect some data, do a literature review, and so on and so forth, you could come up with a hypothesis just to say obesity affects infection rates after laparotomy. Okay, so the first part of that of the research that you've done is also a good research, because you started off with a problem and you collected data to make observations to then generate a hypothesis. So that itself could be a study. And then you have to obviously complete the cycle, if you like, but by testing the hypothesis. But it doesn't mean that research without hypothesis or exploratory research is bad research. It doesn't mean that at all. Right. Now we'll go on to types of hypothesis. There are a number of ways in which you can categorize hypothesis, and I'll mention a couple and then come to the most important way of classifying hypothesis in a minute. So I've just outlined at the start of what a hypothesis is, that you can either get a hypothesis based on observation, or you can get to a hypothesis based on a theory. You can deduce a hypothesis based on a set of phenomena. So the first approach, based on observation, is called inductive hypothesis. And the latter approach is called deductive hypothesis. And that's just some useful terms to keep in mind if you're going to get involved in research. The other way of looking at hypothesis is to see if it is directional or not, non-directional or directional. Now, what does that mean? Again, we'll use the same example. So if you state that obesity affects infection rate after laparotomy, you're making a clear statement there, but you're not really saying whether it increases the infection rate or maybe it protects against infection. So you're being a bit nuanced, or you're being non-committal about the direction, and that's called non-directional, or some would say bidirectional hypothesis. On the other hand, if you say obesity increases infection rate, or you say for some reason obesity actually reduces infection rate, then you're committing yourself to a particular direction in which you think the association is heading towards. So that's called directional hypothesis. Okay, so I hope that's clear. And then we go on to what we call, or what you probably all heard of, are the null hypothesis and the alternative hypothesis. And that's what I'm going to spend another couple of minutes explaining. Okay, so the null hypothesis. So I suspect a lot of you have heard of the null hypothesis. Essentially, it is a statement that is generally accepted, but not yet proven without doubt, or maybe being debated or contested. So that's what the null hypothesis usually refers to. And then once you have a null hypothesis, you want to collect data to test the data set against this particular statement or the null hypothesis. A lot of people would say a null hypothesis is the hypothesis of no effect or no association or no difference. But occasionally, and just keep this in mind, it's not wrong if you say that the null hypothesis is the hypothesis of no effect, but occasionally the null hypothesis can have a particular direction or can state a specific positive or negative association. Okay, but in common practice, in most clinical research, you would start off with a null hypothesis, that is the hypothesis of no association or no difference. For example, no difference between two cancer treatments would be a hypothesis. Right, so our null hypothesis in the example of obesity and infection is that obesity does not influence infection rates following laparotomy. So it is the hypothesis of no association. Now, if you then do a study and test this null hypothesis and then reject the hypothesis because your data doesn't support it, then you've got an alternative hypothesis, often called HA, H alternative, or H1. So that's the opposite of the null hypothesis. Okay, so this is something that will be accepted if you have enough evidence to reject your null hypothesis based on the data that you're collecting. All right, so if you have a study that shows that obese patients have the same infection rates as others, then what would be a reasonable conclusion? So your data shows, say, for example, obese patients have a 5% infection rate and non-obese patients have a 4% infection rate. What would be a fair conclusion? And you show that this difference is not significant. Gio, you want to take up on that? Yeah. Gio, Josh? You guys still here?
Yeah, I'm here. Yeah.
Yes, sorry, I was just saying that, yeah, the null hypothesis would be the one confirmed.
Okay, so what you have to be careful in saying is that you are not able to reject the null hypothesis.
Yeah, true.
So from a statistical perspective, you don't say that the null hypothesis is confirmed or the null hypothesis is accepted. Okay, and this, we can talk about this for 15 minutes, but you might need to just spend a little bit of time thinking about this. But what I'm saying is that you ought to remember that you can never conclusively prove the null hypothesis. Okay, so I think it was Einstein that said that I could do 1,000 experiments. Okay, I could do 1,000 experiments, but I can't prove myself right. I can't prove my hypothesis, but a single experiment can prove me wrong. So the take-home message is that the null hypothesis can never be established as the absolute truth. You can only get evidence to reject the null hypothesis. Okay? We'll go into some examples and we will hopefully clarify that a bit further. Right. So when you are doing a research study to test a particular hypothesis, there is the potential that you're going to make mistakes, or your study is going to be prone to errors, right? So if you're saying your hypothesis is obesity does not affect infection rates following laparotomy, and then you go about designing a study, it could be a retrospective cohort study, it could be a randomized controlled trial, it could be whatever design. You've done the study, you have to accept that your study potentially can be faulty. And there are two types of faults or errors that clinical studies or research studies potentially can make. They are the type 1 error and the type 2 error. Okay, a lot of us have heard about the type 1 and the type 2 error, and often we tend to forget what they actually mean. But hopefully this kind of refresher will cement your understanding. So look at this table. Just spend a few seconds looking at the table. So essentially it starts off at the top with the null hypothesis. And if you assume that the null hypothesis is true, or if you think that that is the truth in the real world, and then you do a study, and if you're unable to reject the null hypothesis because the data shows that the infection rates are very similar, then you simply say the null hypothesis stands, or I'm not able to reject it, and therefore a lot of people say, oh, then it's accepted. Although I've just said to you that you can never prove the null hypothesis, but you just accept it because you don't have enough evidence to reject it. So that is the top left cell, where you say you're not able to reject the null hypothesis when the null hypothesis is actually true. Now, if the null hypothesis is true, but you have rejected it by mistake, because the null hypothesis is actually true and obesity is not related to infection, but for some reason your study has found a difference, then you've committed what we call a type 1 error, or it's called alpha. Okay? Now, if you take the scenario that the hypothesis is false, in that obesity does have an impact on infection, and you have found that and you've rejected the null hypothesis, then your study is adequately powered, and this is the bottom right cell in green, and the probability of rejecting the null hypothesis when it's actually false is the power of the study. Okay? Now, if the null hypothesis is false and your study is unable to reject it, or you're not able to find a difference between infection rates in obese and non-obese, then you're committing a type 2 error, also called the beta error. Now, this might be a little bit confusing to get your head around, but you've got to have a little think about it, and then it'll make sense. It's not very complicated. It might appear complicated if you're hearing it for the first time. So I'll summarize again, because this is really important. A type 1 error is the probability of rejecting the null hypothesis when it is in fact true. So assuming that obesity doesn't affect infection, and if you found a difference, and if you think there is a difference, then you're committing a type 1 error. Whereas a type 2 error is the probability of you being unable to reject the null hypothesis when it is false. Or, in other words, obesity does affect infection, but you're not able to prove that in your study. Then you're committing a type 2 error. Okay, I hope that makes some sense. If not, you just have to go back to the slides and think about it. Now, both the type 2 error and the power of the study, together, both these concepts are very closely related to sample size, and they're dependent on sample size. And this will be very logical. So if you have a very small study and you're looking for difference, you're not going to be able to find a difference because the study has very small sample sizes. Okay, so then people often will say, oh, your study is not powered enough. In other words, you're more prone to committing a type 2 error. In other words, in a small study, you're not going to be able to find a difference, even if a difference truly exists. Okay, so I hope that makes some sense, and you can feedback if it doesn't. Then the question comes, can you design the perfect study without any error? Josh or Gio, whoever's got the mic on.
Well, probably mathematically you can, but not in real life.
And why is that?
Well, because you don't have, you can only make an estimate of the sort of the difference or the outcome that you're expecting to pick up. You don't know what the actual difference or the actual outcome is going to be.
Yeah. So essentially, the first thing you have to keep in mind is there's no such thing as the truth. Okay, so there's definitely no such thing as the absolute truth, right? And all of your research is being done on samples, not on whole populations. You can't take every person in the world, potentially subject them to laparotomy, look at the BMI and conclude. So your samples can only be used to make generalizations, and any sample from a population may not necessarily be generalizable or may not take you to what you consider as the absolute truth. And because you're making inferences from samples, you are prone to making errors. Okay, so that's the reason that it is not possible to design the perfect study. Okay, so you do your best to reduce bias, accepting that whatever you do to reduce bias will increase the rigor of your study, but will not eliminate type 1 and type 2 errors. If you try your best to reduce type 1 error, you could still be prone to type 2 error and vice versa. Okay, right. Now let's carry on. And how much time have we got, Ben?
Saba, we're coming up to 7 minutes to 9. You've been going for about 19 minutes now. Okay,
so another 2 or 3 minutes?
Yeah, I mean, you've been asking questions as you go, so we've only got one question from the floor. So if you want to continue, and then I'll ask them a couple of minutes.
Right, so there's a statement here. Josh, have a look at it. So it says that conventional treatment of thyroid surgery is with open surgery. Robotic thyroidectomy is being compared with open surgery in a trial. And the trial results show that 30-day complication rates are 10% with open surgery, 5% with robotic thyroidectomy, and you've got a p-value of 0.8, which has been obtained as a result of you running a Fisher's exact test. So how will you conclude the results of this trial? I'll show you 3 statements, and you just pick up which one you think is the right one. So the first statement says that robotic surgery is better than open surgery. Okay. The second statement states that robotic surgery is no better or no worse compared to open. And the third is a statement that says there's no evidence to suggest that robotic surgery is different to open surgery as far as infection rates are concerned.
I feel like this is a trick question. You talk about sample size. So what is the sample size then?
I'm not giving you the sample sizes here. That's all the information you have.
So from just look at a statement, the statement concluded that robotic surgery is better. Oh, sorry. Robotic is better, isn't it? From the statement.
Okay. So that's wrong. I'll tell you why. Because we're short of time, so I'll just whiz past this. So although it appears that robotic surgery has a 5% complication rate as opposed to 10% in open, and that's the clinical feeling you get is, oh, there's a significant difference, you haven't been able to demonstrate it in a statistical sense, or you haven't been able to prove it, because the statistician would say that difference came about purely due to chance. Just by chance, you got a big difference. So you cannot conclude yet that robotic is better than open. Okay, we'll discuss this further in other tutorials. But the essence here is that you haven't shown a statistical difference, so you cannot say robot is better than open. Now, then you could say, well, can I say robotic surgery is no better or no worse or the same as open? You can't say that because, like I said before, you cannot confirm or prove the null hypothesis. All you can say is that there is no evidence to suggest that robotic surgery is different to open surgery. Okay? So what we're trying to say here, again emphasizing that a null hypothesis can be rejected but can never be proven. So if you do a really large study and show that you've got 10 versus 5% rates and a p-value of 0.001, then you have the evidence to reject the null hypothesis, and then you can say that robotic is better than open. But until then, all you have to say is that we don't have any evidence to say robotic is different to open. Okay? This might appear like it's semantics. It certainly isn't. This has got a lot of statistical sense behind it, and often we find it very difficult to get our head around the statistical sense. But this is something that is really important that you need to keep in mind. And when you are writing a paper, this is really, really important. People, a lot of us make the mistake of confirming that the null hypothesis is true. It is not something that we should keep in mind. That it is not something that we should be doing. Okay, I'll give you another quick example. I'll ask Gio to comment. So there's a case control study comparing the relationship between smoking and bladder cancer. That shows that 10% of patients smoked and 9% of controls or healthy people smoked. You got an odds ratio of 1.1 with a 95% confidence interval of 0.8 to 1.4 around the odds ratio with a p-value of 0.6. So how will you conclude the results of this study? Again, reiterating exactly what we talked about. Gio?
Yeah, okay. Well, again, you can't reject the null hypothesis. You don't have any statistical data to say that the odds ratio ranges from below 1 to above 1, and the p is not statistically significant. And
correct. So what will you say? How will you explain in your discussion? You will say
that you cannot say that smoking is statistically associated with bladder cancer. You cannot say that.
Yeah. So you cannot say smoking does not predispose to bladder cancer. All you can say is that you do not have enough evidence. Yeah, you do not have enough evidence to rule out an association between smoking and bladder cancer. That's all you can say.
Yeah.
Okay. So remember that absence of evidence, just because you don't have the evidence, doesn't mean evidence of absence, or doesn't mean that smoking does not cause bladder cancer. You just haven't been able to establish
prove it.
Yeah. Okay. So learning point summary, and then we'll go to that question. So we talked about what a hypothesis is. It's essentially a premise or a statement that remains to be tested. Okay. Keep in mind that not all research needs to have a hypothesis. Okay. You can do exploratory research about a particular problem in mind. We talked about the different types of hypotheses, but the most important thing to keep in mind in terms of types are the null and the alternative hypothesis. Any hypothesis testing is prone to errors. And the two main types of errors, or just the two types of errors you can commit, are the type 1 and type 2 error. And every study is prone to this, one of these errors. And we talked about how to appropriately conclude on the hypothesis based on the data you have. And the key point here is that the null hypothesis cannot be proven beyond doubt. If there's any one point you want to take away from this 15-minute talk, is that the null hypothesis cannot be confirmed or established. You can only reject the null hypothesis. Okay.
Thank you everyone for tuning in and listening. Until next time, keep running your life with our surgical podcast.